respond when law enforcement come, and had more of a focus on that. And again, this is why I brought some of our deputy and an officer here to answer any of those questions that I couldn't answer. Again, working with law enforcement for 9 years now and training them, yeah, I've learned a thing or two from them and how to respond. But again, I'm not law enforcement. And again, one of the goals here is to create that relationship, to create a level of trust, or a beginning to do this. And so who better to tell you? Why do I need to tell you when I have law enforcement partners I work with and who can provide that information directly. In addition, Officer Roberts did bring some pamphlets that they have created. Now, some of the information that is on here is outdated as far as numbers and resources, but the information on here addresses exactly what was on that flyer with how to respond, mental health emergency guidelines for calling 911, what to do in a mental health emergency, before calling 911, during, what to expect, all of those things. Here's a brochure. I'm going to go ahead and have that passed around. And so you have this as a guideline as well. And if you have any questions with regards to what's on here, you can ask, and we'll answer those. So any questions?
So I know you were saying your goal was to, divert and keep them out of the ER, and try to, if the family can transport on their own, try to divert 911 calls and that sort of thing. I just kind of wanted to make a comment on that. I did that for years with my son. I'm an emergency room nurse, and also I was a charge nurse for 10 years in the ER, so always diverted 911 calls because I know how that is. So I always transported my son myself on to the hospital, did all that. I wasn't aware of the crisis teams till probably in March. And so I actually utilized the mobile crisis team twice to my house. First time they came out, they talked to my son, I transported him. He was placed on a hold. The second time they didn't transport him. My son's very manipulative when they come out. So they were able to talk to him, and he's very agreeable, so they kind of de-escalated the situation. The third time my son needed to be transported, I didn't call because I figured I was going to have to transport him myself. He's going to just, say all the right things. And so I did take him to the ER. He was agreeable like all the other times, and took him to the ER, and he assaulted me in the parking lot. So, it's like, at what point do you stop transporting? Because, at that time, he was very agreeable. Okay, let's go. Like he always does. He pretended like he was going to walk in that door like he always does. So it's kind of hard to gauge when do you stop, being the transporter.
So what I can say about that is that's one of the things that the team does, is that they do assessments, and a lot of times what we're doing is we're working with the family to collaborate and gather as much information as possible. So if by chance you're working with the mobile crisis team and you feel like maybe there's some more information that they could be told, like, hey, you've come out before, here's the results, but I'm not so sure this is actually the direction that we should be going in. I see him as, having these manipulative behaviors, and then you can say, I want you to be sure to assess him, for safety, because if you are aware that he is maybe potentially going to be aggressive, you can always let us know. And if he does that for the first time, then it's really difficult.
Yeah, it was the first time that he actually assaulted me, but his behaviors were escalating. So the being psychotic at night and not sleeping and, chanting to Satan all night long. And, there was just behaviors that were just escalating where he's, talking to voices and yelling and cussing out the voices at all times of night, in the day, yelling at us. I mean, the behaviors were escalating to that point. So the aggression towards me physically hadn't gotten to that point, but the behaviors were at that time. And so he's like, yeah, I'm hearing voices and I'm having psychosis. And they're like, yeah, he's admitting to it that he's having psychosis, but we can't, hold him. He's not suicidal, he's not homicidal. And he actually kept, he was just on a hold for gravely disabled because the voices were telling him to go to Rancho and be homeless. And he was just on a hold for that, and I had called the crisis team because he was threatening to leave again. And it was one of those things, well, he's gonna go to the clinic on Monday, and and so at that point, I just felt like I'm just gonna be told I can take him to the ER myself again, like I've always done, and he was agreeable, and that's the point that it escalated to.
So let me throw it over to my to the panel over there, and so they can just, if you have any input or thoughts about that or suggestions.
Well, I would say that if you think he's going to be violent, make sure they know, because then they know they can direct it towards CBAT. As far as him being violent next time, it's hard to tell you because you as a parent know your child better than I do or anybody else. So at what point do you need more help and you should not be transporting? At the point where you don't feel safe. Okay, it's as simple as that. Him hurting you does not help him. So if you need law enforcement help, you need to call. And if we show up and an officer tells you, yes, he's in crisis, but no, he doesn't meet our criteria, and we're not going to violate his rights, even though sometimes we want to, because people are in crisis, they do need help, but we're not going to violate their rights. Don't let that discourage you from calling again and again until we can help you. If he's doing something before we get there, but like if he has schizophrenia and he can be manipulative and he doesn't do it when we show up, then videotape him with your cell phone and show the officer what he was doing before, and the therapist before we got there. Give us as much ammunition as you can so that we can help you and get the results you want. But if he is in crisis but doesn't meet our criteria, unfortunately, we're not going to violate his rights.
I understand that. And of course, if I felt like, I've always felt like my son could hurt me just because of his illness and just the type of things that he does. It's one of those cases where you don't know if he's going to stab you in the middle of the night. You sleep with your door locked. I've dealt with that since he was 17 years old. So you really don't know. And like I said, I've worked in the ER for 22 years, so I have a lot of experience with it, but it's just one of those fine lines, and I just feel bad for the other parents out there with even my experience in navigating that. And, even with the videos of him chanting and all that, that just wasn't enough. And you just see the behaviors escalating. And I think sometimes the teams need to listen to the families as well and listen to those subtle signs of, or even, I know you have a criteria and they may be in crisis, but you have to listen to history too. When certain behaviors are escalating, my son's telling the voices are telling him I'm going to be dead in 2 months, his mom, and he's just flat affect about that, his mom who he loves normally, these are all escalating signs and symptoms. And it was headed to that point. I didn't know when or where, but it was definitely headed to that point. But I don't want to take up anyone else's time. I do have a question for law enforcement at the end, but I want to give other people a chance.
Yeah, and I wanted to go ahead and if you could pass it over to Candace. I know Candace had some input as well, and I appreciate you not wanting to, you want to have, other people have questions, but this is relevant to everyone. It really is, because this kind of thing happens. So it's okay for us to spend some time on it, because there's other folks who have experienced this and or wonder as well. When is when? What do we need to say? What do we need to do? So Candace?
Yeah, just like Officer Roberts was mentioning, I'm not sure if these times were you calling 911 when you...
I have never called 911 because, like I said, I'm not gonna, like you said, you're gonna divert. I wanna decrease 911 calls. I work in an ER. I was a charge nurse in a San Bernardino County ER for 10 years. I just left during the pandemic. I know what a 911 call is. I'm not gonna call 911 if I can trust my son was not physically attacking me at that time. He's in crisis. I know he needs to be put on a 5150. I can take him to the ER and they will put him on a 5150. Every time I've taken him, he's been put on a 5150. He's been put on numerous 5150s. So that's what I did. I wouldn't call 911 if I didn't need to, you know? And some of these times, he would not hold him, just because, like he said, his criteria is different than when I take him to the ER, and the ER doctor's criteria versus the licensed clinical social workers that know my son, who have his whole record on file at Kaiser, they're gonna hold him. So if he comes to my house and I'm telling him certain things, they're gonna just say he doesn't meet criteria. He's very manipulative. He can tell them I'm gonna do this and that, be very calm, and so they're not gonna do it. So it's not gonna be helpful for me to call 911. You know, I've seen it in my ER so many times too, when people try to, you know, well, we need to call and get people on hold because they won't come inside the ER. So I'm very well aware of that. So I've always tried to avoid it because I want to help them out. I'm not going to waste their time. There, my son got to the point where he would say, I'm going to die suicide by cop if you call 911 to the house. So I absolutely was not going to have police come to my house and even put them at risk or my household at risk. So that wasn't going to happen either unless it was absolutely necessary, you know.
Right. Yeah, of course, I would suggest that if you feel that you are in danger, or others in your home would contact 911. And what you're describing, that you tell dispatch, he's made statements that suicide by cop, so we're aware when we get on scene. And of course, the officers are trained to de-escalate, and we're going to try to not use any force in verbal command, excuse me. But I feel if you don't feel you're safe, definitely call 911. And I'm not sure if you saw the cities, if you're in any of the cities that CBAT's in, but even call and again, either ask or request for CBAT. Like my boss was saying, we might not be available, but when we do hear the calls come over the radio, we do try to become available for these types of calls and assist patrol when we hear them come out, just to avoid these types of situations.
What would you have liked to have had happen?
I just feel like, you know, the one time that I did call the crisis team out, I was hoping, the time in March, I was at the point, because I'd never asked for help. If they would have said that they were able to transport him, I think I would have felt a little more, supported at that time. They were great. And I have nothing against the crisis teams. Both the crisis teams that came out were amazing. But I just felt like when they're like, well, I'm going to be honest with you, ETS, I'm going to tell you, even if I did write the hold, they're probably going to just let him go, taking the kite, And you just feel defeated, you just feel like no one is listening, and you're just frustrated. And so you feel like you have nowhere to turn. And that's just such a big barrier in mental health today with families, You just feel like you're hitting a wall,
Thank you.
So I hear you, and this is why we have these meetings, so we can bring back information from you guys. So currently with Laura's Law, they're building the infrastructure right now. We're hiring people, we're getting people set in place. It is what I call, it's like a living organism, right? And so once we get done building the infrastructure, we're doing tests right now. So some people have been selected to go through Laura's Law, and we're going to see how that is going to work out through our whole criminal justice system, in addition to mental health court, vets court, and all those different things. So it's being built, and I hear you. And I'm actually on the committee that is part of that. So I hear you guys, and yes, we should all be communicating, right? Just because it hasn't happened doesn't mean that it can't happen, and it should happen. So just be very patient with us. It doesn't. I'm hearing somebody say be patient. It doesn't help, but the infrastructure is being built right now as we speak. thank you for your guys' passion.
And
Yes.
with that, if I could get your phone number, if there's anything we can do to help as moms, dads, brothers, sisters.
My home number or my work number?
Your work.
I got you.
I could use a vacation if you're on.
I got you. We'll talk afterwards.
Okay, we have a Spanish question here, and I'll be providing interpretation.
Yo solamente quiero hacer este comentario porque sí tenemos la necesidad de tener más equipo.
So, I don't have a question. I just have a comment. There is a great need for a team.
Yo llamé un jueves con una emergencia. Mi hijo es bipolar.
My son is a bipolar case, and I called on a Thursday to the police station.
Salí de mi casa y mi hijo me dijo, espero que cuando regreses no me encuentres ahorcado.
I made this call because as I was leaving the house, my son told me, don't be surprised, when you come back, I'll be hanging myself.
Yo llamé el jueves, esto fue el jueves. Me dijeron que no tenía ningún equipo disponible.
So I made this call on Thursday, and the answer that I received was, we don't have available team today.
Yo tuve que enfrentar la crisis. Me dijeron que esperaban que el viernes tuvieran un equipo disponible.
So I had to deal with this crisis on my own on Thursday, because they told me that they will not have a team ready until Friday.
Llamé el viernes, me dijeron que después de las 8 de la noche.
So I called on Friday, when this team was supposed to be ready, but they said it will be available until 8 p.m.
A las 9 de la noche me llamaron y me dijeron que llamara el sábado.
So they called me at 8 p.m. as agreed, but they told me that they will.
Que llamara el sábado para ver si tenían algo disponible.
So the response was, call us on Saturday, so we can discuss if there's an available team.
Ya no llamé. El domingo me respondieron la llamada. Me dijeron que si todo estaba bien.
So I didn't call on Saturday, but they did call me on Sunday, and they asked me, is everything okay?
Es muy frustrante estar con la necesidad, con la emergencia y no tener la respuesta del equipo adecuado para la situación.
So as you may understand, it could be very frustrating when you have this situation in front of you and you do not know how to deal with it, and this is the type of responses that you receive.
Entonces, lo único que espero es que tengan más recursos para que tengamos más equipo de crisis.
So I guess
De
it,
experiencia.
so because of my experience, the conclusion here is, we need more teams, we need more resources, more ready available when there's a situation like this. Thank you.
I have some comments or questions. A call was made to 911 or a mobile crisis. Where was the call made to?
¿A dónde habló?
911.
911?
Yes.
And there's no teams available?
¿Y no había equipos disponibles?
What area?
Riverside.
Anytime you have
Es
a,
más, me dieron la explicación de que el equipo estaba en el desierto. Me dieron la explicación de que el equipo estaba en el desierto y que solamente cuenta con un equipo en Riverside.
So, to expand on this response that I received, I remember now that they did explain to me that there was a team, but it wasn't available because it was busy somewhere in the desert, and there was not an available team in Riverside.
That's not, I don't think she was told her.
Okay, so, do you want to say something?
I was going to say, anytime there's a mental health crisis, law enforcement should automatically respond, whether it's a team or not. There should be a deputy or an officer responding to her residence if there's a mental health crisis.
And if there's not a CBAT unit available, a mental health unit available, then a field officer goes, but never wait and, yeah, that's.
Esa fue mi experiencia.
I'm just sharing my experience.
Yeah, thank you. Is this a new question?
New question.
Oh, let me finish here. May I finish?
Yeah.
Okay. So, that's horrible. Horrible. You know, it's heartbreaking. And there are going to be times, yes, we have programs, we have individuals that are out there doing this work and doing a darn good job at it to keep you safe and to support your, I'm just going to say your babies, you know, your loved ones. However, there are going to be times too, with everything that we're saying that's positive and that's good that's out there, there are going to be times when things don't go the right way, when it doesn't seem right. Again, this is why I love the Family Advocate and Parent Partners so much, because you have family members, you have individuals with lived experience going out there and educating you all on what to do. That's why we're here today. And so what I can say for that, because that just, again, it's heartbreaking. It makes me angry, it makes me sad, it makes me all sorts of stuff. What you can do when things don't go right is you can ask to speak to a supervisor. Regardless, you know, whether it's law enforcement, can I speak to a supervisor? That you know what options you have available when things don't go right. Do you know what I mean? Instead of feeling at the mercy of and just left there with nothing. Sometimes as family member, again, and I'm a parent as well, it's like, and it's frustrating, but sometimes we gotta fight and we gotta be like, okay, no, I will not take no for an answer. What do you mean there is no team available? Can I speak to the boss, the head, the chief? You know what I mean? Not all of you are going to know the terminology, I mean, whether it's a deputy, a corporal, a chief, whatever. Ask for whoever you need to. Can I talk to somebody? Do you know? I don't want you to stop and feel like that. So whatever you can do to become educated and learn what to say, what do I need to say? This is what your family advocates are about. They can tell you what to say because they've been there, done that. Or they can contact us when they don't know and they can talk to a deputy. What do they need to say in order when this so we cannot have this happen again? But it will happen again. You have to be prepared, right? You got to be prepared because you don't just want to be there and feel absolutely helpless. Yeah, I'm sorry.
Yo tengo un problema también con mi hijo y mi hijo también me ha dicho que se ha querido quitar la vida y yo no sé qué hacer. Yo para mí le llaman 911 y si ando a los 15 10 minutos ahí los tengo a los servicios.
So my situation is a little different. My son here, who was here earlier, I have issues with him. He has also told me that he has wanted to take his life. So I called 911 and I received a response in 15 minutes.
Me han ayudado, lo han llevado al hospital de Clemente.
So they have helped me, and he has received mental health treatment.
Yes. Proof, right? Yes. There's successes, there's failures, there's challenges, there's positive. Yeah. Gracias.
Yo he ocupado la policía al 911 por mi hijo porque yo soy una madre soltera y yo me ayudes a ellos porque yo no voy a poder con mi hijo, soy una mujer. Entonces, si los 2 veces los he ocupado por día, las 2 veces han llegado los policías me han ayudado. Y me han hablado cómo entender a mi hijo antes de hablar conmigo.
So I just want to say one more thing, and that's I struggle with my son, you know, physically. I can't deal with him. So the police department have helped me twice already during the day. They have sat down with me and have coached me how to talk to my son even before this happens. So I'm very appreciative about that.
Wonderful.
We had a question up here.
I just want to know exactly where did the hours for CBAT?
Yeah. Good question.
And we're in Moreno Valley.
Okay.
So the times that we've called, I've called 911 and I have a guideline that we were given. So they were never available and it was on the weekend. It always used to happen on the weekends.
Always, right?
So they actually just sent a sheriff out there and they were really good.
Yep.
So they sat with him, they talked to him, they de-escalated, but we've never had a chance to actually use CBAT because they weren't available at the time we called.
Right, yes. So Moreno Valley is 6 Wait, no, 7:30 to 6 PM.
Okay, and that's
Tuesday through Friday.
Oh, Tuesday.
Yeah,
through Friday.
they work 10 hours, 4 days a week.
To 6:30.
So no weekends, as of now, no weekends, and no swing or graveyard for that. So that's the only CBAT unit we have right now, and our Moreno Valley unit is busy. It's busy.
That was good,
Yeah.
because the officer that did show up at the house, when we called like after 8, huh? And he even told us, if you need me, I'll be around here, call me, I see your address, I'll be back.
No, it's
And he spent like 30 minutes with our son talking to him.
It's fantastic.
Yeah, and I always ask him, do you want me to call? And I think somebody from CBAT or Crest, I don't know, called him and talked to him on the phone.
Yeah.
They did.
So when we don't have teams available, again, on the weekends, graveyard swing, our Harupa Valley, their swing, and that's 9:30 to 8. But when we don't have teams available, what we tell our field officers and deputies is that if you go to a call, you go to home, and you're like, this family, this individual definitely needs some support, they leave a referral for our CBAT unit, and during the day, they go and they outreach.
Yeah, they even told me the last time, about the family advocate program. And so, which was good.
Yeah.
And I just asked for the brochures again, but we've always had the officers come, and they've been good with it. And they always tell us, I'm not mentally, I haven't been trained in a mental health, but I'll try my best.
Right.
And they're good.
Well, that's
they've been good with him.
And what's interesting about CBAT is that you have the best of both worlds. You have law enforcement and you have the clinical therapists. And time is not even an issue. So we would take as much time with your son, your daughter, whatever. So that's not we have a lot of patience. So
Yeah, like I said, he was just like an officer. We were like, wow. We couldn't believe it.
They're out there.
Yeah.
A lot of them. Yeah, good.
Can I add something to that?
You may.
Just real quick, I went to 2 calls today where the person specifically said, if Officer Roberts is available. One, because I had dealt with that person twice in the last 3 years, and the other because I had dealt with the family that knew the person that was calling, and so it was word of mouth. Okay. You can, if you call and there is no CBAT officer on duty, you can, whatever cop shows up will be well trained. And you can ask them, hey, can you have the CBAT officers call us? We do that all the time. In Lake Elsinore, I had to 5150 someone here in Riverside who lived in Lake Elsinore. And I got a hold of the Lake Elsinore CBAT team and asked them to contact the family just so they had a face-to-face, they knew they were available, and they went down there and contacted the mother. So if a cop comes to your house or a deputy, you can ask them, can you have the CBAT officers or therapists contact me, give them your name and phone number, and the therapist will probably get back to you. It may not be, in 20 minutes, but it may be, 4 days later if they're on their weekend. But they can call you, get in touch with you, and you can, express your concern so that when you do call 911 a month from now, if they're lucky enough to be the ones to show up, they have some background.
That's a great suggestion. Again, training you a little bit too on what to say or what you can do to maybe get the support that you need. So I like that. I like that. So yeah, if you're not, again, to reiterate, if you're not, a CBAT unit isn't available and a regular field officer or deputy responds, put that out there. You know about CBAT now, and to say that, can you have your CBAT team follow up? Yeah. Thanks for that.
So this is our first time of getting to any kind of meeting, She's been to Al-Anon, but I read a letter today that she wrote about our son in 2012. And, saying how much it hurts her to see his brain or his mind being shattered and dealing with these things. And it was a great letter and very loving. And that's 10 years, We've been trying to figure out how to get him help. And we keep hitting those walls. And his girlfriend is so patient, and she's been trying so hard. Sunday, we finally got a message out, I guess, and Then this morning, Francisco called me and referred me to here, but I know this is crisis intervention kind of situation and mobile care and all that. It sounds wonderful, but we need, some kind of roadmap. We need to learn how to navigate all of this. And I'm hoping that somebody can kind of guide us. I don't even know where a mental health urgent care is. He has brought himself to that mental health place off Magnolia a couple of times, up by Tyler Mall, and spent it. Huh?
That's it.
And then, Corona Regional Emergency Room, and they watch him, and he knows exactly what to say. He's got that rapid speech, and he's got all these big words, and everybody's real impressed with him. And then, he'll come in and he'll have beaten the hell out of his face. He doesn't hurt anybody else yet, but it scares the hell out of us. And then we want to retire. We want to sell our house. And he's 33. It's like, get a job, But I say all the wrong things. I'm trying to learn how to do this.
Yes.
And so if there's anybody that can help, I'd sure appreciate it.
There's a lot of somebodies. You're in the right place.
Have you heard of NAMI?
No.
I learned about it.
So, sir,
NAMI.
sir, you are in the right place. You are talking to the
Welcome home.
You are talking to the right person, you guys. Francisco Werther will help you guys transition through this roadmap and all these curves and turns and all that stuff. So thank you guys for speaking up and being transparent. And taking the first step. And hopefully we can support you through this, because it's a long journey. It's going to be a long journey, but you do have support. You got family here. So we're going to try to take care of you as best as we can.
The motto for the Family Advocate Program is, we've been there, we can help.
Yep, they've
The
navigated.
mental health urgent care is located at 9980 County Farm Road.
You know where it is.
I have a question for law enforcement. So, being a family member, how can our families help you guys out when you guys make a call? What types of things and situations should our family members know when there's contact with law enforcement and the crisis team? So what should our families know about that?
Okay, so nobody wants to call the cops on their child, because we're going to show up with sticks and we're going to hit them and put them in the hospital, and you don't want that, okay? That's not what's going to happen. California cops, we spend billions of dollars every year training police officers. Okay, so first off, don't be afraid to call. Nobody wants to hurt your son. When you call the dispatch, the operator is your first contact, okay? They may not ask all the right questions. So if your son is in the bedroom screaming, but he always does that, well, that's not why you're calling the cops. Make sure they understand why you're calling the cops. Yeah, he has schizophrenia. Yeah, he's screaming. But today, he picked up a knife and threatened me. Or today, he's starting a fire in the backyard. Let them know, why are you calling today? What's different? Okay? Understand that the cops that show up don't know you. And we don't know your son or daughter or mother or father. Okay? We are going to do things that look scary, but it's to protect them too. So if two cops show up, and I'm going to pick on you two just so I'm addressing somebody, if you call the police and say, my son is in the backyard and he started a fire on the shed and we put it out, but we need help, and the cops show up, you can expect them to put your son in handcuffs, okay? That is not a bad thing, because if he is having an outburst and he swings at us, we're going to defend ourselves. But if we get him in handcuffs right away, it helps de-escalate the situation, okay? So if you see a cop handcuffing your loved one, don't think they're going to jail. They're not. Don't think it's something bad. It's to de-escalate, okay? If your loved one has weapons, we need to know that, because that's going to dictate how we handle the situation. Okay? If he has a knife, well, I'm not gonna just walk right up to him. I'm gonna ask him, where's the knife, throw it on the ground. That way it doesn't put me in danger. And if I'm not in danger, then he won't be in danger. Okay? If he has a gun, we need to know that, because we're not gonna call the SWAT team and storm your house. But I could park 3 doors down and try to call him on the phone and say, hey dude, we're here, we need you to come out and talk to me, I wanna see your hands. You know, we heard there's a gun in the house, we just wanna do this in a way no one gets hurt. So you let us know about weapons, let us know if he's on drugs or on alcohol. Let us know what he's diagnosed with, okay? And the cops that show up are gonna be well trained. They're gonna wanna take charge of the situation, and they're gonna wanna make sure it doesn't escalate, okay? Whether it's setting him on the curb, handcuffing. And please, if your son is like autistic, make sure the dispatcher knows that. Make sure that you know, he doesn't like to be touched, because we don't wanna, if not handcuffing him is gonna prevent a fight, then I won't handcuff him, I won't touch him. So you gotta let us know these special needs, let us know what triggers him off, Whatever you do, don't ask him to take off his hat, he'll wanna fight, Let us know what sets him at ease. He has 2 kids, that'll bring him down if you talk about his kids. Anything you can do to help us help him or her is great. Do you wanna add?
Yeah. Also, don't get in the way of their detainment. If you get involved in us placing him in handcuffs, most likely you'll be placed in handcuffs as well. I had a situation where someone was being placed on a hold, and I had to handcuff their son. He swung on me, he missed, but his mom was placing herself in between me and her son, preventing me from putting him in handcuffs and placing him on the gurney for AMR to transport him to ETS. Eventually I had to place her in handcuffs for getting involved in my duties. So please do not get in the way of their detainment.
Okay, we have one more question in Spanish.
Ok, bueno, yo vine aquí, toda mi familia vino aquí para aprender acerca de las crisis, como en este caso lo que está escuchando de señora allá en la esquina.
So my family and I came here today to understand more about this crisis as a family and learn more about this.
Nosotros tuvimos una situación hace unos 10 meses quizás con mi hijo.
Our family experienced a situation about 10 months ago with my son.
Mi hijo estaba en una crisis que nosotros nunca habíamos visto su comportamiento, cómo se estaba comportando en la casa con nosotros. No estaba agresivo con nosotros, no nos estaba golpeando, pero él hacía cosas que nunca habíamos visto.
So our son started demonstrating these types of behaviors that we had never seen before. He wasn't aggressive, he wasn't trying to hurt us, but he was doing things that were out of the norm.
Entonces, yo llamé al 911 y pedí que me mandaran, ayuda médica. Y me dijeron que era lo que estaba pasando, les informé que era lo que estaba pasando con mi hijo.
So I called 911 and told them that I need medical assistance, and they asked me, what is happening with your son? So I told them what was going on. Excuse the interpreter, I'm just gonna probe just a little bit.
¿Qué estaba haciendo su hijo? Mi hijo estaba haciendo cosas como movimientos que nunca hacía, gritaba, y pues eso nos alarmó a nosotros porque se golpeaba la mesa, se golpeaba él, pero a nosotros no nos golpeaba.
So just for you to understand, some of these behaviors included banging on the table, screaming, waving his hands, being erratic.
Entonces, cuando yo hablé al 911, me contestó la operadora y me empezó a hacer preguntas y de ratito me dijo que me iba a mandar a un policía. Entonces yo no esperaba un policía, yo esperaba la ambulancia.
So after speaking to the 911 responder, she said she would send a police officer to my house.
Pero dentro antes de que la mandara, me empezó a interrogar, a preguntarme qué ropa traía mi hijo, cuánto pesaba, qué altura y el color de piel, su pelo, todo su descripción de persona de él.
So this responder asked me, before we send the police officer, we would like for you to describe your son, his height, his weight, what is he wearing, so they will be able to identify him once they came to my house.
Entonces, pues yo nunca he ocupado de un servicio de emergencia hasta ahorita, hasta fue la primera vez. Yo no sabía qué hacer en ese momento con mi hijo. Yo lo que quería era ayuda de emergencia para ayudarlo a él.
So since I have never been in this situation, I have never been asked what type of information that I needed to provide. I just needed to help my son. That's what was on my mind. How can I help my son? And this is the response I received.
Entonces a los minutos llegó y me tocaron a la puerta y ya salí yo y llegó un oficial y ya me dijo, para esto yo le saqué videos a mi hijo cómo se estaba comportando y se los enseñé a él.
So within minutes, there was an officer there at my door, knocking on my door, and when we started a conversation, and I was able to show him some of the videos of my son's behavior, so he could get a better understanding.
Entonces él lo que me dijo que si iba a pasar a verlo, le iba a correr su récord y posiblemente le iba a arrestar. Pero pues yo no quería que se lo llevara, yo quería llevarlo a que lo atendiera. No estaba agresivo, no estaba golpeando a nadie. Entonces le dije que no, porque yo no sabía en ese momento que mi hijo, qué reacción iba a tomar cuando él mirara al oficial.
So at this point, my son had not seen the police officer. He was still at the door, and he said, I need to do a search on his background check to find out on your son, to arrest him if I need to, or find out. So that was my fear. Why are you checking out his background check? Are you gonna arrest him? Now that's not what I need. And then when my son sees this cop, how is he gonna react now? That was my fear at that time. So that's the situation I was in at that time.
Entonces, ya que se fue el oficial, tratamos de calmar a mi hijo. Le dijimos que si nos ayudaba a llevarlo a la clínica, mi esposa y yo, y él dijo que sí, ok, se metió a bañar, pero el ratito se le pasaba la crisis, en el ratito se venía, y total,
Todo esto mientras el policía está ahí.
No, ya,
¿Se fue?
el policía se fue.
Ok, gracias.
El policía se fue y me dijo que si necesitaba, que le llamara.
So the police officer left because I refused for him to come into the house and handcuff him or any situation. So my wife and I then decided to talk to my son, reason with him, and tell him, we need to take you to the hospital. Can you cooperate with us, your mom and dad? He said yes. Took a shower, got dressed, and at this point, this is where the interpreter broke. Was the cop still there? At this time, the cop had left already.
Entonces en el camino pues es algo frustrante, algo triste. Escuché la historia también de la señora. Mientras yo manejaba, mi hijo en veces le venían las crisis, se golpeaba él, golpeaba el carro, pero a nosotros no nos tocaba. Total, llegamos a la clínica, nos anotamos y ahí estuve en espera como una hora quizás.
Okay, so on the way to the hospital or the clinic, he was pounding on objects in the car, he was hitting things, and he wasn't aggressive with us, but we got safely to the clinic.
Durante el tiempo, al tiempo que llegamos ahí ya, bueno, lo pasaron, lo atendieron. Ratito ya mi hijo ya estuvo bien. Lo único que yo quiero saber, ¿qué debe hacer uno en estos casos? ¿Cómo puede uno pedirle a un oficial, en vez de que digan, me lo voy a llevar arrestado, no podían ellos ayudarnos en decir, ¿sabes qué? Pues te vamos a ayudar a llevarlo a la clínica o te vamos a ayudarlo a llevar a este lugar donde lo puedan atender.
So the point of this story is that finally we got to the clinic and he received the treatment he needed. My question is, next time this happens, when the officer comes, can he maybe assist me to take him to the clinic? Can he maybe assist me to take him to a rehabilitation center instead of that option he provided, which is to run a background check and then arrest him? That was the proposal on behalf of the police officer. So is there something else I can do? How can I request this type of different scenario?
So yes, okay, but in police work, we like to say that we have a toolbox, okay? And nobody wants to go to work with just a hammer. We like to have as many tools in our toolbox that we possibly can, okay? By running your son's name, he finds out whether he had a felony warrant for murder or not, okay? Because he's not gonna go in there by himself if your son's wanted for murder. He finds out he doesn't have any warrants, he feels a little more comfortable, okay? If he had a warrant, and he went in to talk to your son, and he said, yes, your son is definitely in mental crisis, he definitely needs help, but he doesn't meet our criteria for 5150, I cannot force help on him. Maybe he could have arrested him for the warrant, got him down to the jail to see the jail nurse. And the jail nurse, they have therapists in the jail that can also help. Because that's the goal, is to help your son. It's not to arrest your son, okay? But there are only 4 ways to help a person, okay? One is the easiest, but unfortunately in our job, it is the least used, and that is voluntary. If your son says, I want help, this county provides tons of help in different programs. But if he says, I don't want help, we can't make him go. Okay? The second way is a 5150. And that we can do, but he has to meet our criteria in order for us to do that. The third way is to arrest somebody. As bad as that sounds, but we do get them to the jail. They do have medical staff. If he's injured and refusing to go to the hospital, they do have therapists there. If he needs to have mental help, okay? And the fourth one is like conservatorship, or if the courts get involved. Okay, so by asking these questions of you, I wasn't there, so I may be wrong, but my impression is he wasn't looking to arrest your son. He wanted to know what the situation was and trying to get more tools in the toolbox. But we cannot force ourselves into someone's house. I can't force someone to talk to us so we can evaluate them. You definitely have a right to expect us to come and want to help. You definitely can express that you just want help transporting him to a facility, and we can do that, absolutely. But if he doesn't volunteer to go with me, I want to know what options I have before I walk in that door, not after. Does that make sense? Anything you want to add?
So we're running a little bit out of time, and I see a pattern here. We need more help. My question is, who do we talk to? What board of supervisors? Whose ear do we as a community get into to request more of these services? What can we do as a community to help you get more teams on board? Is there anything we as a community can do?
Again, being part of the Family Advocate program, you can definitely tell your family advocates what you need. The family advocates then take it to those that are above me and express those needs. Now, I think, you know, we have a lot, we're expanding these crisis services, and I'm a supervisor over crisis services. I support the program. We also need more therapeutic services. We need treatment. We need treatment so that individuals don't get to a situation where they're in crisis, right? We need more preventative and treatment. Nevertheless, when I'm listening to all the questions, There definitely needs, and there's a lot of power in this room, and there's a lot of power with our family advocates with regards to education, because maybe some of these situations, maybe, again, yes, law enforcement and behavioral health, we need to do our part, absolutely. But, and family members need to do their part as well, right? So what can we do as family members so that next time when we do call law enforcement, we're not met with frustration and or confusion when something happens and we're like, why did this happen? And maybe we're learning a little bit more today than we knew before, so we know when we call 911 that this is what to expect. Instead of calling and thinking something else is going to happen, but not really knowing what's going to happen, right? And then we get frustrated when something happens. Like even just the handcuffing. And I know a lot of individuals do not like that. Like they really get they're offended by it. It's hurtful, it's traumatizing to your senses, your spirit. Nevertheless, it's law enforcement you're calling out, and so law enforcement has certain procedures and roles and responsibilities, and safety is the first one. So cuffing someone doesn't mean that they're going to be arrested. Now maybe law enforcement can say to individuals that they're encountering, we're going to put cuffs on you, but you're not being arrested. Maybe that would help. Maybe that would put you at ease as well. And absolutely they're trained to do those, to have those kind of communication skills. Doesn't mean it's going to happen all the time, but for you as family members to understand that cuffing isn't bad. It's, again, you're calling out law enforcement. You're not calling a mental health professional out. And so if we can eliminate any risk, again, just like Officer Roberts said, any risk that we can eliminate to decrease tension for the officer and for you and the consumer, then we don't have to think about those hands going somewhere else. Do you know what I mean? And now we can just focus on what's going on, right? But again, getting more informed about what are the protocols, what are the procedures, what can I say, what shouldn't I say, what do I definitely want to add in and make sure I say, but I'm embarrassed, so I don't want to say it, but I got to get over being embarrassed and I need to say exactly this. I need to be as transparent as I can. My son's decompensated. My son's behavior is worse today. You're telling me he doesn't meet criteria for a hold? You're not going to help me? It's gotten worse. I know he's telling you everything that you want to hear, but I'm telling you, it's gotten worse. He's never been this aggressive. He's never said these things to me before, and now he's doing this. I'm afraid for myself because this is different. This is different today. We're supposed to take that information. We're supposed to take that information and take into account. Where was your son then and where is he now? Is there a decrease? Is there a decrease in, or, is there an increase in symptoms and behavior is worsening? Heck yeah, we got to take that into consideration. Yeah, so I mean, you've got a lot of support and a lot of resources here, and you have a voice for sure.
If I could suggest something, and that's true, if I could suggest something to all families is to have a couple paragraphs written down, because you never know, 1 minute they love you, 1 minute they hate you, but to have a couple paragraphs written down in the drawer by the phone or in your pocket or in your glove box of your car where you can just read it. He suffers from this, he takes this kind of medication, he has this problem. And then ask, he has a mental health history. Can you bring an officer and somebody that's familiar with mental health? And maybe they'll say, okay, well, one of these two gentlemen here will be available to come. And also NAMI, the National Association for Mental Illness, has a very good program here in Riverside. And they have access to these forms that you can keep on your phone, or they're reimagining mental illness with a 288 number instead of a 911 number, where you get a professional that can guide you through what's going on. So join NAMI or just call them up and see if you can take the family-to-family course. It talks about communication between you and your loved ones so that you're not escalating it and triggering them. Right. Learning more about mental illness.
Yep. Yes.
To recap what Ms. Nordine was saying about Care Court and building a database, you are that database. You know your children better than anybody. So collecting a chronological timeline of events of either crisis through AB 1420 form, or creating a timeline of events of how his mental illness has progressed, and relaying that information to officers or the hospital or whatever agency your son gets involved with is key, because we only know what we have in front of us. but you know what has happened last month and the month before. That way we can connect the dots and base our treatment options based on what had happened and how things have escalated. So just get in contact with the family advocate. We have those forms as AB 1424, and we can get those to you.
I have a quick question for law enforcement. This wasn't your agency, but when my son assaulted me in the parking lot, of course he took off. So I'm trying to get him on a hold, and he took off running. So I went looking for him so I could find him because I knew they probably wouldn't find him. I was able to find him. I was on the phone with 911. He was able to jump in a lift because he had the card for his social security account, so he lifted. So I'm on the phone with 911. We went through several different agencies. No one got to him. So he was able to get away in Rancho Cucamonga. I was just wondering how that works when someone takes off after they committed a crime like that. It made it very difficult for me. I went back to Riverside to make the report because I was willing to press charges because I wanted my son into treatment. So I had no problem with him going to jail at that point. So he got away. I was on the phone with Riverside Police Department, on the phone with CHP as we entered the 15 freeway, onto Riverside, on the phone with Rancho Sheriffs. I lost him in Victoria Gardens before the sheriffs could get there. So by the time the sheriffs got there, there's no police report at that time, but I have injuries. I'm telling them I was assaulted, he's mentally ill, I gave him all the history, pictures, look out for him now, he's dangerous. He's potentially dangerous to others. They said they would look out for him. But I need to make the report with Riverside. So I went back, I made the formal report. I said I wanted to press charges. Since then, I've heard nothing. I don't even know how the process works. There was never a warrant issued. So when I ended up making a missing persons report on him to still try to get him forced into treatment, I live in Riverside County, I live in Jurupa Valley. So I called the sheriff's department there. They told me to call Rancho because now he's homeless in Rancho. That's where he's escaped to. He's not in the county. They looked for a warrant and there's no warrant out of Riverside. So I'm just wondering from a law enforcement point of view if you could just explain that part to me because no one's been able to explain it. I have the report, I filed a report, I'm willing to press charges. And if there was a warrant in the system, because they encountered my son, 2 days later, there was no warrant. They did their field check, he was manipulative, said I'm gonna go to the clinic tomorrow, and they let him go again. So, I just want to mention to the families, Laura Law team is in effect here. I'm working with them, and I finally have networked where they're going to go into San Bernardino County with homeless outreach and get my son off the street.
How old is your son?
But it's been 2 months, 30.
You have the report number?
I do have the report number.
Okay, so I'll explain to you how it works, but after this, give me the report number and I'll call you tomorrow and I'll let you know what I can find out.
Thank you so much, because I've called and left a message for the officer and no one's called me back.
So I can't answer for other stations, but for Riverside only, because the sheriff's department does things a little different. Their officers take on more of a detective role sometimes. We don't. So if you were assaulted, they would have took a report. I know you're his mother, but in my eyes, you're not. You're a grown adult, he's a grown adult, and that's how we look at it. If he's 17, it's different.
Sure.
But at 18, you're just two adults. So did you sign a private person's arrest form?
He didn't have me sign anything. He just took the report. He said, are you willing to press charges? I said, yes. I had injuries at the time.
Okay.
He took pictures, and that's
good.
Where we left it.
Okay, so what will happen is either two outcomes. They found him or they didn't find him.
They didn't find him.
Well, I know, but I'm trying to
okay.
explain the process to you.
I'm sorry.
So if they find him, and in Riverside, if it's just a battery, a simple battery, it is a misdemeanor.
Mm-hmm.
Our jail here in Riverside will not take misdemeanors, so he would get a ticket, okay? If it was major injury, it becomes a felony, and then he gets booked into jail, okay? If we did not find him that night, then the officer writes a report, it goes to the detective bureau. The detectives then investigate it. They get with the prosecutor's office to determine if they're going to write a warrant. Fortunately, crime, as you know, is on the uprise. Our detectives have stacks of reports. So how long exactly does it take for it to get a warrant in the system? That depends on how much crime is on his desk at the time. I can run his name and find out if he has a warrant as of now and let you know tomorrow. I can try to find out where in the process it is for you. But it's going to go to a detective, and then he either gets a warrant or he doesn't, depending on what the detective and the prosecutor's office think. And then after that, nothing happens until we find him. We serve the warrant, he gets arrested, gets a court date.
Yeah, I've been searching the court, I know in Riverside, and there's no case or anything that's been assigned yet. Since he's been out on the street, he committed another crime, he battered somebody else in San Bernardino County. That case hasn't even been in the court, isn't in the court system yet. So this has just gone on so long, and it's just an example of how, you know, I've kept him in my house for all these years, and I've prevented this for all these years, and then this one breakdown in the system, and now he's out in the street, and there's been 2 people now battered. So thank you for explaining that.
A lot to take in. This was a great presentation. I want to thank our partners. I want to thank law enforcement and CBAT team for coming out and doing all your best. Thank you. Also want to thank our speakers for all the work that they do and the professionalism you guys have. So thank you, and let's give them applause. This is exactly what I want. I want this to be, sometimes we have to talk about the hard stuff, right? And sometimes we have to talk about stuff that's uncomfortable, but that's okay. Because when we do that, we get results, right? It may not be tomorrow, it may not be, you know, within the week or so, but these hard conversations need to be had so we can make changes. So I also want to thank you guys for coming out. You guys are wonderful. I appreciate each and every one of you guys from the bottom of my heart. So thank you guys.